Hello, I'm Joan Justice with HealthWorks Collective, and I'm here with Dave deBronkart. Dave really needs no introduction, but I'm going to introduce him anyway. Known as ePatient Dave, Dave is a cancer survivor, an internationally known keynote speaker and author, and the leading spokesperson for patient engagement. Dave has some definite ideas about how patients can help make healthcare pricing more visible, which in turn would reduce it. So, Dave, why don't you go ahead and tell us about your thoughts?
Well, the main thing that people need to realize is that although we're not accustomed to acting like ordinary shoppers who care about value, both quality and price, we're not accustomed to doing that in healthcare. It turns out that the more you dig into it, the more you raise your awareness, the more legitimate that is. There is wide variation in quality of care, and there's incredible variation in pricing that's all been shielded from us in the past, at least those of us who had regular health insurance. But you and I both have high deductible plans now. Mine is $10,000. So every single thing I have until I have a catastrophe, every single thing is stuff that I actually pay for like a normal shopper.
Right, me too. I have $5,000 deductible, so.
And I very quickly found out that, well, there's a couple of things. I've got to focus. How can patients help improve healthcare? By acting like normal, intelligent shoppers. Ask, how good is this and how much is it going to cost? And do I have any options?
Yeah, yeah. That's the best advice I think you can give anyone that goes to a provider for healthcare. And what do you think about the term pricing transparency?
Well, I'm a marketing guy, so choice of words is important to me. I've also had a sort of a hobby being an amateur fan of culture change, and there's so much about culture change that has to do with changing the language we use for things. Mm-hmm. Now, for somebody who has lived in the healthcare economy for decades, there's this abstract concept of transparency, which is like being able to see through the shrouds mm-hmm. that have hidden information. I'm a much more mundane guy. Like I went to a Mexican restaurant a couple of months ago with my wife, and on the margaritas page, there were no prices listed. I did not ask the waiter for some transparency. I said, how much are these? And we need to do exactly that in healthcare. There's a famous health economist named Uwe Reinhardt. Uwe is a German first name, wonderful guy, funny speaker. And he wrote a paper published in the journal Health Affairs in 2006 about healthcare pricing. And the headline called it Chaos Behind a Veil of Secrecy. Mm-hmm. We need to not ask for transparency. We need to say, let me see the prices.
Visibility. More like pricing visibility.
Exactly.
And where will this pricing visibility lead if all the prices are visible and they're getting more and more visible online?
Hallelujah. It will lead to healthcare improving in the consumer's terms mm-hmm. Like any other normal market. Mm-hmm. There are two essential things that you have when you go shopping for a television set or a car that you don't have in healthcare. And by the way, I am not comparing television sets to medical care. Right, in terms of how complex they are. Mm-hmm. My life was saved by brilliant doctors and nurses performing the results of brilliant research. But still, the two things that we don't have in healthcare are information on price and quality and the ability to take our business elsewhere mm-hmm. if we're not happy. Mm-hmm. So what really bothers me, this is not just like a patient rights or consumer rights issue. I want the best clinicians, the best hospitals, the best doctors, the best nurses to be recognized for that in the form of all of us bringing them our business. Mm-hmm. Mm-hmm. Today it's not easy to do that. We don't even have an easy way to know who the best ones are, much less the best value.
That's right. That's right. What we need is value. The best ones at the best price.
Yes.
Like Best Buy.
Yeah, exactly.
Something like that. So, and where do you think the biggest challenge in reducing healthcare costs lie?
Well, the first thing, I have the greatest respect for the complexity of the healthcare professions. It's a massive, massive, we can't comprehend how big the industry is. There was a big report in September from the Institute of Medicine called Best Care at Lower Cost, and it said there's $750 billion of excess spending in American healthcare.
You mean waste?
Waste.
Yeah, waste.
Yeah, unnecessary scans, things that are overpriced. And to comprehend that amount of money, I looked up, so what if Apple Computer went out of business? How many billions would that take out of the economy? What if IBM went out of business? General Motors, like 8 companies like that, all of those combined are less than $750 billion. So the biggest challenge, I think the biggest challenge is in price visibility. Because if you ask the people at your local doctor's office, or when I had a skin cancer that I had to get treated earlier this year, I asked the dermatology department, how much will this cost? They truly didn't know.
No.
I had to go to person. I couldn't yell at them. Nobody'd ever asked them that. So that's right. Important for us to start asking.
Yeah, great.
I think it's the biggest challenge.
Good. And what advice would you give patients when shopping for health care?
Number one, be aware there are differences in quality and safety. Okay, there's a hospitalsafetyscores.org. There are new services that are coming out recently, Clear Health Costs, HealthCare Blue Book, Castlight Health. Some of them are only available through employers. But you can start, first of all, ask your employer if you have one, if they have a service like that, and start asking everyone else, ask your insurance company. I've been amazed to discover that some insurance companies don't want to help me find out what options are. Are they just on commission? So costs are not a problem to them, but other ones are. So ask your insurance company, can you help me lower my costs? And if they say no, you might want to consider finding a different insurance company. But be aware there are differences in price and quality. In fact, maybe I should end by pointing out there's a famous surgeon, a wonderful speaker named Atul Gawande, who at the Medicare Innovation Summit last January, he had this brilliant 60 seconds. I wish it were a YouTube clip. He said, there is a curve on quality of care, substantial differences between the best and worst. There's also a curve on cost of care, substantial differences. Surprisingly, the two do not match. Now, my first reaction was, doesn't that just make you mad? Us people don't have the best price. But he said, and that means there is hope. Because if the best did cost the most, then we would be talking about rationing. But we're not. Instead, we just need to find out what works.
The value.
Exactly.
Yeah. The value. Great advice. Thank you so much, Dave. And I urge anyone that's interested in patient engagement and the quality of health care, and that should be all of us, of course, to go online and look at some of the excellent resources available. And there's a lot of great information out there. And when you go to your healthcare provider, ask to see the pricing.
Exactly. And do everything you can, to help to find the best doctors, nurses, and hospitals, and tell other people about them. So this can start to function like any other market that rewards the people who do the best job of what customers want.
Right. Thank you so much.
Thank you so much.